Hi, I'm Stuart Factor. I'm a neurologist at the Brain Health Center at Emory. And in partnership with Miracle for Mom Foundation, we're going to talk today about neurodegenerative diseases. And in particular, we're going to talk about biomarkers. Biomarkers are biological changes in diseases that can be measured that may help us with better diagnoses, measuring progression of disease, and even providing targets for treatment. And today we have two people at Emory who are doing biomarkers research. Dr. Lenore Higginbotham, who is studying proteins in cerebrospinal fluid in the brain, and Dr. Dan Huddleston, who is doing imaging markers in Parkinson's disease and related disorders. So Lenore, maybe you could say a little something about your research and what you're doing, and maybe tell people about spinal taps too, and how not to be afraid of those.
Okay, yeah, definitely not something to be afraid of. But in terms of my research, so I work in a lab that studies proteins in neurodegenerative disorders. We're looking for markers that, as Dr. Factor said, can be measured in the brain, and particularly in places where it's more clinically accessible to measure them, like in the spinal fluid and in the blood, actually. So these are protein markers that we're hoping we can actually turn into something that we can measure in clinic to either help diagnose patients or actually use as targets for therapy, or use as targets to just see how you're doing in response to treatments. Our lab has actually been doing a lot in Alzheimer's already, and Alzheimer's, out of all the neurodegenerative diseases, is probably the most advanced in protein biomarkers. Alzheimer's already has a few that they measure in the cerebrospinal fluid in the clinic at times. Amyloid and tau, these are two big protein markers that are actually being measured in the clinical sphere in Alzheimer's disease. However, what we found with amyloid and tau is there's some issues with just using those two biomarkers for everything that we want to do with Alzheimer's disease. We haven't been as successful as we'd liked targeting amyloid for treatments. Tau is not necessarily only found at abnormal levels in Alzheimer's disease, and so we're looking for more specific ways of identifying Alzheimer's. So our lab looks at globally, we get a global picture of proteins using something called proteomics. So we're able to take a spinal fluid sample or a brain sample and measure thousands and thousands of proteins in that sample and find ones that really correlate to disease. And the latest of what we're doing, and also a paper that is also being prepped by another group across the world in Germany, we found very similar markers, which is exciting, so reproducibility, for a variety of different pathways that are implicated in Alzheimer's. So we're getting all these proteins that reflect a lot of different things that are occurring in this neurodegenerative disease. And we're hoping that this kind of comprehensive picture will help us more adequately recognize the disease, more appropriately treat the disease. And we're very excited about that. One other thing that I'm doing in the lab that I'm bringing to the lab is actually applying all these proteomic techniques to cognitive decline or thinking and memory problems in the Parkinsonian disorders. So I'm particularly interested in looking at protein markers of thinking and memory in Parkinson's disease dementia, Lewy body dementia, and all these other related Parkinsonian disorders such as PSP, MSA. We're looking for markers of cognitive decline in those disorders. So we're really excited to actually bring this kind of technique to the Parkinsonian world and measure cognitive decline there.
Great. Dan, you want to talk about imaging?
Yeah, thanks. Thanks for asking me to speak. So I'm Dan Huddleston, movement disorders neurologist here at Emory, and as Stuart mentioned, my focus in research is using imaging to develop biomarkers for Parkinsonian disorders. So Parkinson's disease is the most common Parkinsonian disorder, but there are a variety of other atypical Parkinsonian disorders, progressive supranuclear palsy, multiple system atrophy, dementia with Lewy bodies, and others. So, as was mentioned sort of at the outset, we have some urgent needs in biomarker research, and in particular in neuroimaging biomarker research. We don't have any neuroprotective treatments for these diseases, unfortunately, but there's an opportunity to make our clinical trials more successful, and that would be through biomarker-directed clinical trial design. So an overarching goal of my research is to use neuroimaging to help improve the selection of the right patient for the right clinical trial, and to monitor disease progression. And if you can monitor the underlying process that's causing these diseases, then that might be something that you could use to determine whether a drug is working also. So we think that if we have successful diagnostic biomarkers, to identify which kind of Parkinsonism a patient has, and if we have successful progression markers, then we would be able to improve clinical trial designs significantly. And there's really, it makes a lot of sense to study all these diseases together, because one of the fundamental questions when you're running that clinical trial is, do I really have a Parkinson's disease patient in my Parkinson's disease trial? Do I really have a progressive supranuclear palsy patient in my PSP trial? So we use MRI, and there are other imaging techniques that you can apply to do this. And we're always excited when people are willing to join us in our research. Recruitment is one of the major challenges in research. So that's something where we rely on the community and appreciate everyone's interest in what we're doing.
That's great, thanks, Dan. Neither of you mentioned, and I just thought I'd throw out there, neuroinflammation, which is a big part of all of these diseases. So you're measuring proteins that are involved in inflammation, correct?
Yes, we are. So that, like I mentioned before, we are interested in proteins that are involved in these diseases outside of these really hallmark ones that you hear about, like so amyloid and Alzheimer's disease, synuclein and Parkinson's disease. We're looking beyond that and looking at all these other systems that may be involved, and inflammation is one of the big ones in all of these disorders that have many proteins involved in them.
And Dan, there can be some imaging of inflammation, right?
That's right. So there are PET, so positron emission tomography, a special kind of imaging, can detect molecular problems and diseases, including inflammatory markers. So that's sort of a direct way. I focus on MRI. So in MRI, there are a number of markers of neurodegeneration that probably reflect local inflammation. So for example, the loss of dopamine cells, many patients will know this, with Parkinson's disease and related conditions. The loss of dopamine cells is kind of the core pathology. So we can actually image that with MRI because those dopamine cells are in areas that have a special pigment that we can image with MRI called neuromelanin. So we use neuromelanin sensitive MRI to measure the loss of these dopamine cells, and actually what's happening is that neuromelanin is cleared, is that there's an inflammatory response, and so microglia, little cells come in and they eat up this pigment called neuromelanin, and it's removed. And we can image it with MRI, and if even at if you have a brain from a healthy person and a patient who had Parkinson's disease, you can see black stripes in the healthy brain, and those stripes are gone in the Parkinson's brain or the Parkinsonian brain. So we can image that and hopefully apply it to some of the uses that I was mentioning.
And that's been a big focus now in clinical trials. There are now trials in a variety of neurodegenerative disease trying to tamp down the inflammatory response to neurodegeneration. So thank you both, and join us next time when we'll talk about some of the clinical trials that are out there. Thanks very much.